Welcome back to the What's in Your Head podcast, Tools for Pain and Dizziness. I'm Pete Schultz, Doctor of Physical Therapy. Before we begin, remember this podcast is for educational purposes only and isn't meant to replace medical advice from your physician. Recently, I had the opportunity to participate in a podcast with Dr. Heidi Prather and Dr. Ellen Casey, who are physiatrists at the Hospital for Special Surgery in New York City. We discuss pain in women in their midlife. One of the biggest messages from the conversation was that pain during midlife is rarely caused by one single thing. There are hormonal changes, sleep disruption, stress, reduced activity, changes in muscle and bone health, and changes within the nervous system that all interact together. Today, I'd like to build on that discussion from the perspective of a physical therapist, because one of the most common questions I hear from this population is, why does everything suddenly hurt? In my practice, I work with a lot of people who are experiencing pain. One of the biggest misconceptions about pain is believing that it always means that there's some kind of damage. But many times, pain is a result of several systems interacting together. Women in midlife, where you're balancing careers, teenagers or young adult children, aging parents, poor sleep, changing hormones, less time for exercise, more stress. And when you add these things together, the nervous system can become overwhelmed and more sensitive. Pain could become louder and smaller aches could become larger aches. Recovery might take longer, and it doesn't mean the pain isn't real. Quite the opposite. Pain is always real. Pain comes from your nervous system, but pain doesn't always equal injury, and it doesn't always equate to the amount of damage that there might be seen on an MRI. And oftentimes, you have a lot of pain, and there's only minimal damage shown on imaging. Sometimes your alarm system, and remember, pain is a protective mechanism from our nervous system, sometimes that alarm system becomes overly protective. And sometimes that alarm isn't accurate. As a physical therapist, my goal is not only to treat the muscles and the joints and the musculoskeletal system, it's trying to calm the entire system. I'll always explain that you have your musculoskeletal system, you have your bones, joints, muscles, nerves, but then you also have a pain system. And these two systems are separate. They interact closely with each other, but they're separate systems. One of the things that's really unique about midlife, especially for women, is that pain isn't just about the muscles and joints anymore. There are hormonal changes that can actually influence how the nervous system processes pain. As estrogen levels fluctuate during perimenopause and menopause, many women notice that the conditions like migraine become more frequent. Joints may feel stiffer, sleep could get disrupted, and recovery from exercise doesn't really feel the same. Estrogen has an important effect on the brain, inflammation, connective tissue, and even the body's natural pain-inhibiting systems. When I spoke to Dr. Prather, which Dr. Prather is in charge of the lifestyle medicine clinic at Hospital for Special Surgery, she explains really well that estrogen, it's like a cap on a hose. If that hose is flowing inflammation, as your estrogen levels decrease, you lose the ability to control the inflammation in the body. And over time, your body has more inflammation that's built up. And now the nervous system becomes more sensitive to that pain. Remember, when we talk about the pain system, there are receptors. You have sensors that are sensitive to inflammation. And if you have more inflammation, those sensitives are more likely to be elicited, and those send signals up to your nervous system, and your nervous system is more likely to create pain in this process. The important thing to understand is that these hormonal changes don't necessarily cause an injury. Instead, they lower your nervous system's threshold for becoming protective. It's a little bit like turning up the volume on the body's alarm system. Activities that were once tolerated really easily may suddenly feel more painful or maybe more difficult or challenging. And hormones are only one piece of the puzzle. Sleep quality, stress, physical activity, cardiovascular fitness, nutrition, and previous pain experiences all interact with these hormonal changes. And that's why two women going through the same period of menopause or perimenopause can have completely different pain experiences. And that's really where physical therapy fits in. When I see people come into my clinic and they're having full body pain or they're having more inflammation and pain experiences, I can't change their hormone levels, and we can't really, as a profession, do anything about the hormone levels, but we can improve many of the other systems that do influence. And when women come into my office who are experiencing higher levels of pain than they've experienced in the past, I'm looking at the whole person, not just looking at the muscles or not just looking at the joints. So I'm looking at restoring joint mobility and strength, also addressing the cardiovascular system through aerobic exercise, the nervous system through pain education, graded exposure, looking at the autonomic nervous system through breathing, relaxation, mindfulness, and biofeedback exercises. What we're trying to do is improve sleep habits, improve confidence with movement, work on your physical conditioning and the nervous system regulation. We often see pain becoming much more manageable when you address these systems. And there is a hormonal component and there is a medication component, but there's a lot of things you could do on the other side and a lot of things you could do on the lifestyle side to make even small changes that are going to make huge differences in the amount of pain that you're experiencing. I wanted to talk a little bit today about movement and how important movement is. Being sedentary, we don't recommend laying down in bed or bed rest anymore for any activities, even if you just had surgery or you just had a major accident. Like, we rarely would recommend that bed rest is a good idea. Movement is so important. And we, as a profession, physical therapists, need to get people to move and need to get people to not be afraid to move. We don't want people being afraid to move, thinking they're going to make anything worse when they have pain. It's actually the opposite. We want people to move and enjoy movement and do things that they enjoy, because movement, it nourishes cartilage, it strengthens bone, it improves circulation, it calms the nervous system, it could improve sleep. When people are exercising and moving more, they sleep better, their mood is better, they're more confident. So instead of avoiding movement, we help people find safe ways to move again. I always say that you could always exercise no matter what's wrong with you. If you have a broken leg and you're in a cast and you can't put weight on it, you could find some exercises to do for your upper body. It's always important to move your body. Let's talk a little bit about an area that I work with a lot is migraine and headache. So when you're in the perimenopause or menopausal, the hormonal changes during perimenopause can make migraines more frequent. Women will also notice that migraines become more frequent and more unpredictable. But hormones are usually just one factor. There are medications and supplements and things you could do to adjust the hormone levels, but that's only one piece of it. What we could look at, the things that we can change, are sleep habits, stress. We could look at the neck, right? Are you having stiffness in your neck? Is there weakness in your neck? How is your posture? Have you reduced your physical activity? Have you not been walking as much or exercising as much? And is sometimes with sensory overload, there's so much going on in your life and it changes the autonomic nervous system and how you could handle stress. All of these factors increase migraine, and they can increase the frequency and severity of migraine. Oftentimes when women come into my office with increase in frequency or severity of headache and migraine, I'm gonna start by looking at the neck, right? How does the neck move? Could the neck be contributing? Is it tender? Are there tender spots behind the skull or in the jaw? We could look at the TMJ, which is the temporomandibular joint. Is it stiff? Is it clicking? Oh, there's a lot of musculoskeletal things revolving around the neck that could be causing some increase in these headache frequency and severity. Then I'm going to look at exercise, right? How much have you been exercised? Sometimes If you're tired all the time, you're not sleeping well, you're in more pain, you might not be exercising as much. We could look at your exercise program and get back to doing the right amount of cardiovascular exercise, because we know that improvements in cardiovascular health can help with the frequency and severity of headache and migraine. I could also I use vestibular rehabilitation. Vestibular rehabilitation is training the balance system and training your vestibular system, because when people aren't moving as much, they feel a little more dizzy, they feel a little more nauseous. There are things you could do with your balance and vestibular system that could help improve vestibular function, thus decreasing some of your headaches. We do breathing exercises to improve heart rate variability. Heart rate variability is your body's ability to handle stress and be adaptable, the adaptability of your nervous system. Breathing exercises, meditation, some different types of body scans. These are all helpful in working on your autonomic nervous system. We also do mindfulness exercises. I like to do pain reprocessing therapy, which includes somatic tracking. When you are experience a headache, you're not ignoring it or trying to really ignore it to try to make it go away, but instead you're observing it. You're observing the sensations, trying to take away the threat of that headache. Oh, I use pain reprocessing therapy a lot for any upticks in headache. And again, these approaches, they teach you not to ignore the pain, but just be aware of them and create more safety in your system and try to help calm an overprotective nervous system. In addition to headache and migraine, there could be persistent pain anywhere in the body. There could be low back pain, neck pain, any part of the body could have persistent pain. Sometimes I'll see people who are experiencing foot pain or knee pain or elbow pain that just doesn't go away. These persistent type of pain is often very misunderstood, and a lot of times when you go to traditional physical therapy or you go to chiropractor, you go to a musculoskeletal health professional, sometimes like you're just spinning and these conditions aren't getting better. A lot of times people are searching for the individual structure that's causing the pain. And if you keep treating that individual structure, let's say you have elbow pain and you keep on working on the elbow and doing ultrasound on the elbow and hot packs on the elbow and exercises for the elbow, the elbow, it's not getting better. We have to look at everything else with headaches, with any hormonal changes in the whole system. You got to look at everything, right? We have to look at sleep. We have to look at exercise habits. We have to look at the autonomic nervous system. When these conditions are going on for months or years, the nervous system becomes extra sensitive and the nervous system becomes better at protecting and it becomes better at producing pain. So this doesn't mean the pain is made up or it's psychological. It's the opposite. This pain is very real and it's happening, and your nervous system is trying to do a really good job by creating this pain. And the nervous system is staying in this high alert stage. Things we could do for persistent type pain would be first education and understanding how the nervous system works. People who understand how pain works and really the mechanism of pain, they usually experience less pain. We're trying to reduce fear, build confidence in movement, and then gradually return to activities. We're also going to strengthen, right? Traditional physical therapy would be strengthening exercises, mobility exercises. I usually use biofeedback, teaching people how to control their nervous system with breathing exercises or how to control muscle tension using EMG biofeedback. We'll use pain reprocessing therapy and somatic tracking to try to do mindfulness exercises to decrease the threat of those pain responses. And the goal isn't to convince people that their pain is imaginary. It's trying to help the nervous system recognize that movement is safe again. And this approach really helps a lot of people, and it really helps with this persistent pain population. One very common presentation or one very common diagnosis that we see in this population, women in their 40s and 50s, is the frozen shoulder or adhesive capsulitis, right? A frozen shoulder is very common in women between 40 and 60 years old. And there are some hormonal changes because the hormonal changes affects inflammation, and inflammation affects the fascia, and the fascia and the capsule get a little more rigid and stuck, and it affects movement and mobility of the shoulder. Well, sometimes frozen shoulder, actually most of the time, frozen shoulders just show up. You wake up, your shoulder's feeling a little stiff, maybe your neck feels a little stiff, then it gets a little stiffer, then it's more painful, then you slowly start losing range of motion, and then all of a sudden you can't lift your arm up over your head. It's really difficult to put a bra on or to put a shirt on, a jacket on, and then it starts to become really stiff, and then it starts to become really painful. A lot of times people just want to force these and stretch them and really push as hard as you can. And that's not always the greatest approach. What we usually focus on first is getting nice pain-free movement, or just getting the shoulder to move, because like I said before, movement nourishes the cartilage, it improves the joint, it increases lubrication of the joint. Just getting these frozen shoulders to move a little bit better is going to be helpful to improving function and reducing the pain. Unfortunately, we do have to stretch these. Manual therapy is very effective to work on the capsule, connective tissue, and fascia to increase blood flow and try to get the muscle tissue and the connective tissue a little bit looser and more mobile. Now, the cool thing about frozen shoulders, they always get better. It might take a while. I've seen some people take a few weeks. Some people, it might take 6 months, but they do get better with movement, some physical therapy, and also we need to do some pain education. Understanding how the pain system works will help you experience less pain, using some mindfulness tools, having better sleep habits, decreasing stress, working on breathing exercises to control your autonomic nervous system. With all of my talks, what we're trying to see here is not just one thing. Stretching isn't the best thing, or massage isn't the best thing. It's all these things together. It takes a lot of different systems that are involved in pain and different types of injuries. And to get them better, you have to look at more than just one system. And although a frozen shoulder, it may take a little time to get better, but most people recover completely without any surgical intervention or anything like that. Often people do get some steroid injections to help speed up the process, but surgery is rarely needed. Women in their 40s and 50s also experience an increase in levels of low back and neck pain. I see a lot of times people that they'll come into the office and they've had their back went out, or they have increased back pain. They can't sit for long periods of time, stand for long periods of time. Their neck hurts. And yeah, sometimes nothing happened. There was no car accident. Weren't lifting something super heavy. Oftentimes people tell me that I think it was I had a tough workout at the gym, or I did this yoga class, but there's no real event or real injury that occurred. They'll often get x-rays and MRIs and imaging, and the imaging usually just finds some normal degenerative changes. But again, like when there's hormonal fluctuations and there's less estrogen, as we discussed before, and there's more inflammation in the body, the pain usually hurts more, and it gets frustrating when you're experiencing this pain for a long period of time. Low back pain is very common. Increase in neck pain is very common. And oftentimes we're trying to find structural issues. They want to find something on the x-ray. They want to find something on the MRI. They could pinpoint it and be like, hey, this is exactly what's going on. But like I always say, it's more than one thing. There's not going to be this one thing that cracks back into place and it's going to fix every pain and all the back pain and all the neck pain. We have to look at everything, right? We're going to see if there's some mobility issues or flexibility issues. We want to get those muscles a little bit looser. We want to get your core muscles a little bit stronger. Oftentimes there might be some increase in tension of the pelvic floor physical therapy, or decreasing some tone in the pelvic floor is helpful for low back conditions. Working on your posture, your seated posture for neck pain. How is your desk set up at work? How are your body mechanics? Are you sleeping well? Are you doing your self-regulation exercises, breathing, meditation? Are you doing cardiovascular exercise? So there's a lot of things that we could do to help to decrease some of this back and neck pain. So when we talk about lifestyle medicine, Dr. Prather started this lifestyle medicine clinic at HSS, and it's going really well. And I see a lot of the patients come through there. It's not only for women in midlife. It's she's looking to improve people's lifestyle, or people who are experiencing pain. They're going to the lifestyle medicine clinic. What is lifestyle medicine? I wanted to explain briefly what the 6 pillars of lifestyle medicine are. Well, the 6 pillars of lifestyle medicine are eating whole foods, trying to eat more plant dominant nutrition, regular physical activity, restorative sleep, managing stress, positive social connections, and avoiding risky substances. Well, there are 6 pillars of lifestyle medicine, and these are all things that we see every day. And these are things that could help your pain experiences. If you're having increased pain, whether it's women in their 40s and 50s or anyone who's experiencing pain, you could make changes in your diet, trying to eat more whole foods. You could increase your physical activity, whether that's going to the gym and doing more cardiovascular exercise, or just parking a little further in the parking spot and walking further, or taking the stairs instead of taking an elevator. Working on your sleep hygiene, trying to sleep more hours, or trying to get healthier sleep habits. Working on managing stress better through increasing heart rate variability, regular breathing exercises, some kind of meditation, any type of self-regulation exercises. Social connection is huge. There's a lot of research that shows that people who have social isolation experience more pain and more disease. And avoiding risky substances like alcohol, tobacco, marijuana, any of those risky substances. Those are the pillars of lifestyle medicine. To wrap this up, women in their 40s and 50s and midlife, there's definitely hormonal factors that are going to affect your pain experiences. And some of the things that we do to help is not just working on the muscles and joints. We work on many systems in the body. And orthopedic physical therapy could help people move better and get your joints moving better, get your joints more flexible, get your muscles a little bit stronger, and just get people moving better. Vestibular rehabilitation helps people with balance, and if there's an increase in dizziness. Pain science or pain education, any of this education on how the nervous system works, whether it's involving pain or whether it's involving stress or anxiety, is helpful to people moving better, being healthier, and experiencing less pain. Pain reprocessing therapy and somatic tracking are tools that we use to decrease danger and decrease threat in the system, and to make people less afraid to move even if they are feeling pain. Biofeedback and neurofeedback are tools that we could use to help the autonomic nervous system, to teach you breathing exercises, teach you self-regulation exercises, to get the autonomic nervous system more adaptable. We talked about the lifestyle medicine principles of eating plant-based foods, regular physical activities, sleep hygiene, stress management, positive social connections, and avoiding risky behaviors. Everyone who comes in, whether you're having headache, frozen shoulder, neck pain, back pain, dizziness, everyone's assessment and treatment is going to look a little bit different. But there's so many things we could do that are outside of pharmaceutical or the medical world that could help these systems and help with pain, help reduce fear, help understand why you're hurting, restore confidence, restore movement, and help you get back to the way that you want to live and get back to the things that you enjoy in life. If you're a woman in midlife and you've noticed more aches, more stiffness, more headaches, pain that seems to move around, pain that's all over your body, you're not alone. It's unfortunately, it's very common. You're not imagining it. You're not broken. Pain during midlife is influenced by hormones. It's very normal. There's increased inflammation, sleep issues, increased stress, physical activity. There's connective tissues issues and your nervous system. And these are all things that we could control. The encouraging news is that every one of these systems can be improved. Physical therapy just isn't about stretching or strengthening muscles. It's about education and movement and building confidence and helping your nervous system feel safe again. Because when we understand pain, we stop fearing it. And when we stop fearing movement, we move better and we feel better. I wanted to give a physical therapist perspective on women in their 40s and 50s, or women who are experiencing an increase in pain or full body pain in midlife. Hopefully that was helpful. And thanks for listening to the What's in Your Head podcast, Tools for Pain and Dizziness. If you enjoyed today's episode, please subscribe, leave me a review so other people could find the show. You could also learn more about our practice at dynamicsportspt.com and find more podcast episodes, learn a little bit more about pain and dizziness at painanddizzy.com. Until next time, keep moving, stay healthy, improve your sleep, move more, exercise more, and I will see you next time.